Welcome back to Wave 3 Listens Live. Thanks so much for joining us this Friday morning. We got our cheesy joke of the day coming up and some movie tickets too, and lots of information for you from Body Shapes Medical. We want to introduce you to Michelle. Michelle is one of Lisa's patients. And Michelle, how much weight have you lost?
Almost 60 pounds.
Holy schmolies. And you're in your second round.
Yes, I'm in my second round.
And this is the HCG diet.
She's done our accelerated weight loss program, yes.
Okay. Can we show you some before pictures? These are fairly compelling, okay? I'm going to show you some before pictures of Michelle. If you can see these, check that out. There's Michelle before. I told her she doesn't look like the same person. Now, obviously, she's got a child on her left. Look at this. Here's another one. Wow. Michelle, you've done so well.
I think I lost 30 pounds in my breast area.
You must feel so good about yourself.
I feel so much better. I mean, I'm energetic now. I have so much more energy, and I'm starting to leave the house more. Before, I wanted to stay in the house all the time because of the weight, but I'm really enjoying the diet. I'm really enjoying it. I actually can't wait till the next phase of it. So I'm really excited.
And we hear that a lot about the confidence. My confidence is up. I'm able to get out of the house more. I do things that I would never think about doing before. And I've heard Michelle say that several times. I mean, it's just exciting when she comes in. And I believe this week, can we tell what you lost this week?
You can tell her anything you want.
She did about 10 pounds just this week.
Oh, wow.
I know. My friends keep saying, how did you do that?
Right.
And I told them, it's the injections. It's the HCG.
Wow. So you also talked about phases. So you're in phase 1 now where you're dropping all of this weight.
Right.
And then what happens?
There's phase 1, 2, and 3. Phase 1, they can do either injections, which Michelle's doing, or they can do a sublingual form that goes under the tongue. Phase 2 is really important. It's a 3-week specialized diet. That's when we start exercising again, and that's when you are going to completely reset the metabolism. So that's why it's real important to make sure you don't just do the HCG portion of it. Phase 2 is 3 weeks, and then after that is where we teach you with the accountability programs how to eat for your body. We still have to figure out exactly how Michelle needs to eat in phase 3. Right. Is she going to be just a calorie control? Is she going to be a carb sensitive person? And we'll find that out with our computer system, and she'll continue to see us weekly so we know for sure exactly what works for her in phase 3.
How exciting.
It is exciting. It really is. I mean, it's a lifestyle change. And being uncomfortable in your own skin is really, really hard to deal with. So, and now I'm not. I mean, I feel so much better. I'm not done yet, but, and I'll get back to working out, and it'll be wonderful.
Right.
We've talked a lot about the perfect candidate, and really the perfect candidate is anybody who's motivated, wants to lose the weight. There are a few medical history things that we have to look at to make sure that you are a candidate, but for the most part, we keep everybody on the same prescription medications that they're on.
Okay.
Now, if you are a cancer patient, you're not allowed to do this program, but we do have other programs for them. But like I said, the perfect candidate is pretty much anybody. If you need to lose 10 pounds, that's great. If you need to lose 100 pounds, we can help you either way, because you can do more than one round of HCG if needed.
Okay. All right. To that end, we have a couple of questions for you, Lisa, if you don't mind. We're going to go first to Bristol, calling from Upton, Kentucky. Hey, Hey, Bristol, you with me?
Hello.
Hi, Bristol.
Hi, how you doing?
Just fine. Thanks for calling.
I got a question. My father-in-law and my mom are both diabetic patients, but what would be the best program for them to lose weight?
Bristol,
because he's always worried about losing weight.
It really just depends on what type of diabetes they have and if they're insulin dependent. The best thing to do would be to have them come into the office and fill out a full medical history, and then one of our nurses will talk with them and see what program fits best for them. Diabetes patients are really easy to work with, and some of them are a candidate for the HCG, and some of them aren't, again, depending on if they're insulin dependent. So just come on in the office. The consultations are totally free. We can go through everything with you and find out which program will work best for you.
All right, Bristol, thank you so much for the call, and we're going to talk to Daryl now, calling from Louisville. Hey, Daryl.
Hey, how you doing?
Just fine, thanks.
The question I have is, I've been on Weight Watchers and lost 50 pounds, and ended up gaining 50 pounds back. So my question is, what's the difference in your program? Because I know Weight Watchers says theirs is not a diet, and I keep hearing you saying about a diet, and then I hear you something about medication as well. So what is the difference between your program and Weight Watchers?
I love that question, Daryl. The difference is Weight Watchers kind of put you into a box like I talked about. They let everybody eat all the fruits and vegetables that they want. Some people are really sensitive to certain type of foods and, for instance, carbohydrates. So we need to be real careful and find out if that's something that you're sensitive to. And I'm not saying that Weight Watchers doesn't work by any means. A Weight Watchers program for someone like me would absolutely work. But my husband, for instance, if he had all the fruits that he wanted, he would blow up. I hope he doesn't kill me for saying that, but it's true. He is not diabetic, but he is insulin resistant. So you need to be real careful. And I say the word diet because HCG is a specialized diet that you have to be on. But keep in mind, phase 3 of the program is healthy living. And I tell all of my patients, you're going to get this weight off, you're going to get it off quickly. But let me tell you something, if you're not dedicated afterwards to making healthy lifestyle changes, which we're going to help you with, then no, you're not going to keep the weight off. You can't just go back to the way that you're eating. But we're going to counsel you through that, and we're going to be your cheerleaders along the way.
You know, nobody has ever said that. I mean, I've never heard anybody say that you can't eat all the fruits and vegetables that you want. Usually you hear people say, oh, yeah, you can eat any fruits and vegetables that you want. But not so.
Not so. I mean, it just depends on the patient. Again, everybody's a little bit different, and that's why we look at everything week by week, day by day, and make little changes. Sometimes it might be a little bit more difficult to figure out one patient than the next. But again, that's why we see you weekly. That's why you're with us for 4 months. And then after that, you can come into our accountability programs where we're just monitoring it, not as closely, but still to make sure that you're keeping that weight off.
All right. Okay, we're going to go ahead and take a really quick break. When we come back, we're going to show you the Exilus, a little piece of equipment that they can use, non-surgical fat reduction and skin tightening. What about that one? So stay with us. We'll be right back.